Hello, my name is Pavel Studeny. I'm a head of ophthalmology department of Third Faculty of Medicine of Charles University in Prague, and my specialization is corneal transplant. I made such kind of surgeries more than 30 years, and I'm also working in Sveti Vid clinic, especially I'm making the corneal transplant. At this moment we have two kinds of transplantation, corneal transplantation. The older one is transplantation in all thickness, it's perforating keratoplasty, and the new type of surgeries are lamellar keratoplasty. Because if the patient has only one layer impaired, it is no need to exchange all cornea, and we can transplant only one lamella, especially the internal lamella. This kind of surgery we named as descemet membrane endothelial keratoplasty. These kind of surgeries are more comfortable for patients because there are no sutures, and healing is much easier than in perforating keratoplasty. There are the less risk of reaction. It means that the cornea is not acceptable for patient, and there is some inflammation, and after that the cornea will be blurred, so the surgery is unsuccessful. But in DMAC, the most of surgeries are successful and very comfortable for patients. So it is my specialty, the DMAC, and I hope that for patient, also for Serbia, it's very big advantage to have such kind of surgeries. The second technique, what we do is also deep anterior lamellar keratoplasty, especially in special kind of disease. We named it keratoconus. This is the bulging of the anterior part of cornea. So in such cases, we exchange only the anterior part of cornea, and the posterior part of the patient cornea are stable and stay without intervention. The next surgeries what I'm doing are antiglaucoma surgery, and also cataract surgery, and also some kind of refractive surgery, implantation of phakic intraocular lens. Very often we are using this kind of surgeries in patients after transplantation, because transplantation is a relatively complex problem, and we very often have to care about the patient long time. Very often we can combine the cataract surgery and corneal surgery if the patient has both tissues, problems with both tissues. So this combined surgery are more comfortable for patients because it's all is in one step, and the reconvalescence after surgery is much easier than if we have to make two procedures. We are using very good corneas. We are the part of European network of tissue banks, so they help us and give us very good tissues. The donor corneas from tissue bank are analyzed against the infection, against some disorders of the donor, etc. And in Sveti Vid we are using the best of the corneas what we can, so it's perfect quality. And I think that together with the very good skills of our surgeons making transplantation, I think that we provide there the best quality care for patients with corneal diseases.